The challenge is there's just too much data coming at you. So you need to be able to take multimodal data, so data from all these different modalities, and be able to bring those together and now help you make a decision. And that's just very overwhelming for a human to do with that much information on that many patients.
I've interviewed many experts that are leveraging AI and digital to improve healthcare, but perhaps the most critical expert in this entire ecosystem is the clinician. Concepts need to be tested and validated by clinicians in places like hospitals, using real patient data to ensure they will work as intended and actually make healthcare more efficient, predictive, and preventative. That's where Dr. Keith Dreyer, based in Boston, comes in.
Dr. Keith Dreyer, really good to chat today. I guess I just want to start by really at the base level, asking what are the biggest data challenges that you're currently facing on the ground right now in hospitals?
So pre-pandemic, it was just massive amounts of data coming at us and trying to figure out how to hold that data, how to assess that data, keep it for purposes of medical records, et cetera. But more exciting, which is the area that I focus in, is how to use that data to then make predictions. In the pandemic world, it's how do you do all of that, and yet you need to keep social distance. So patients may not come to your facility, they may stay where they are, and now have to ramp up an entire virtual experience for those same patients, and then record all of that data, and then do an analytics on that data as well.
How much data are we talking about, and where is this data stored?
In the United States, there's about 3,000 different entities that provide care, and they're made up of a variety of hospital systems. So our system at Mass General Brigham is about a dozen hospitals or more, catchment of a couple million patients. And so that data is in the petabytes of information. And it's considerable amount of data that we continuously store and back up and maintain securely in several data centers. Several hospitals are moving to the cloud. That's happening with time. Healthcare is a little resistant to do that because of the security factors, but the cloud providers are now providing more and more security, so that's happening.
And how difficult is it to make that transition from having something that is stored in a room on a hard drive to in the cloud? I mean, we've done it on our phones, or we're starting to on our phones. How is that being managed in healthcare?
Well, there's a couple of steps you have to take to be able to do that. So all of the devices, how do we capture data is another question. So some of it is typed in by humans as we talk to patients and capture their history, physical information, all of that. But more and more, it's the Internet of Things, the Internet of medical things or medical devices, where we're capturing that information and storing it. So those devices need to become smarter so they can move data off of their systems and onto central systems. And then collectively, we have to take all that data and again, be mindful of the security, but then move that off premises into a central area. All of that takes massive amounts of efforts. And we have thousands of people working just in our information systems area alone to supply those solutions to all of our hospitals.
How is AI helping to process all of that?
If you think about the way that we capture data, we're coming in from, say, magnetic resonance imaging, computed tomography, monitoring data. It's just reams and reams of data. And the way that it's done historically is that a human is analyzing all that information. And then we store it, and then we usually bring it back because we want to compare how the patient was to how the patient is to try and predict how the patient is going to be, or should we change medical treatment. So as an example, one of the challenges that we have in healthcare is to be able to identify a stroke in a patient at a remote facility that might not have high-end technology. And so to do that, you'd want to be able to apply AI tools, software, to be able to identify that problem inside of the CAT scan of the brain that would suggest that that patient has a stroke. And to do that, you would train an algorithm with thousands and thousands of cases of CAT scans of a stroke and non-stroke and train it so that it can see it. And that's exactly what we're doing on all different areas of the body and all different modalities.
So once you've trained it, Dr. Keith, what then happens to, that upgraded, pristine, latest version of the algorithm?
So it's treated like a medical device in the United States. So that means that you have to get FDA approval of that device. So to do that, you have to prove efficacy and safety of that device, much like the vaccines that came out most recently. So we have to demonstrate that algorithm is effective in what it is trying to do and it's safe. So we do that by creating evaluations of that technology with new data that it's never seen before, and then create a study and then submit that study to the FDA for approval of a claim that we say this algorithm is a medical device that can detect stroke, as an example.
What role, Dr. Keith, does the Edison Health Link have then when it comes to that deployment of those approved algorithms, and who is really evolving that and doing all the research on it at the moment?
In the information systems infrastructure is different at each facility. So you have to make that look the same to be able to put a tool on top of that that knows where to go inside the system, knows what data to get out and what answers to put back in. And so that Health Link, that Edison Health Link does that at all the facilities. So it makes many, many, many points look like the same point. So now you can take a single technology and have it apply at various locations all in the same way. For example, I'm the worst person to take pictures, but with my iPhone, I'm an incredible photographer because of all the AI built into that camera, right? But it's not like I say it's AI, it's just a great camera, right? So I think it's the same thing in healthcare, is that when AI starts to slowly penetrate in, we're going to see patients stay healthier longer. We're going to see patients, when they come into hospitals, get diagnosed quicker, be pulled out faster, have devices with them at home or on their body, wearables that are going to keep them healthy. So that is the 5 to 10 year goal, is to bring the cost of healthcare down while we're improving the quality of life. And if that isn't an answer that technology can provide the solution to, I don't know what it is.
So, Dr. Keith Dreyer, that's a fascinating answer on the normalization of AI for sure. Brilliant insights. Thanks for joining me today.